everybody. I'm Michael Higgins with Flex Capital, here today with another installment of Success in the Midwest. I'm here today with Dr. Rich Mason of Mason Family Chiropractic in Fishers, Indiana. And there's a big reason I'm here with Dr. Mason.
My name is Richard Mason. I'm a chiropractor in Fishers, Indiana. I've been in practice since 1997, so about almost 23 years. I always tell my patients, if there's a day I'm not learning, then that's a day I need to shut it down. I need to quit doing what I'm doing. And I always, when I go in with a new patient, I'm always trying to ask the why. Why are you hurting? What factors lead to that? Not just how many times you need to come into me because your insurance plan says 20 visits. Well, at my office, you may only need 7. You may need 8. You may not need 20. And unfortunately, I don't find that in all of the practitioners in the state.
Are there particular techniques or approaches that you have that also separate you in your field?
So early on, I like to impress. They have to do their job at home, not bend the way they've been bending, not keep moving the way they've been moving, but it's our job to assess you're bending wrong, you're moving wrong, and here's how to do it better. And do your home therapy, and then let's do the tissue work. We have 2 great massage therapists that we have in our office who've been both with me 3 years, and they're wonderful.
So ultimately, your patients need to understand, frankly everybody needs to understand, we can't do it all for them. We get them on the right track.
Correct.
Teach them how to do it, teach them how
Correct.
to live a healthier life.
Correct. It is, I'm not doing my job as a doctor if they have to keep coming back to me for pain relief for the same thing. It means we're missing something, they need more imaging, maybe I'm not the right place for them. Maybe
Sure.
they need to go to an orthopedic surgeon or a neurosurgeon, maybe it's something that's beyond my care. I'm very upfront with them on a very short span of time. About 30 days, they should be seeing at least 50 to 60% improvement. If they're not seeing that improvement, then we either change the therapy up and see if we can get up to those numbers, and if not, I'm honest and open with them to say this isn't working. I'm not going to keep wasting your time and your money. I think that's a common respect people deserve.
So I know that a lot of people may have a little bit of a black eye or a misunderstanding of what chiropractic services really are. What are some of the key things that are leading you to properly evaluating and properly treating your client?
Number 1 would be x-rays if they're needed. They're not always needed. That's what also differentiates us. It exposes you to radiation, and the way that I look at it is the only reason to do the imaging is if it's going to change my treatment approach. If someone's in a car accident, it makes more sense to do x-rays
Sure.
to make sure there's no fractures. But if somebody just woke up with a kink in their neck and they've never had it before, the x-rays aren't going to tell me anything differently than me palpating the spine and figuring out these other little issues that may have caused it. Very heavy on home therapy with patients. We show them how to do it in the office. They use a company called ChiroUp, and they get a link to their exercises and stretches, and it really improves our compliance.
So many people work with a physical trainer. Some people work with a nutritionist. You're missing the third component, and that's chiropractic health. If you're trying to live a healthier life, this is something that's important. So I'm going to let him say,
Mason Family Chiropractic and Wellness, if your body wears out, where are you going to live?
thank you very much. Thank you for joining us today.